Hello friends, I'm Kaustubh and today we'll be discussing the topic allocation for healthcare in India. Why have I chosen this topic? It is because when we discuss the allocation for healthcare in budget, we tend to make a mistake. We assume that more allocation in budget for healthcare means better health outcomes for the people. This topic is also important from the point of view of UPSC aspirants because GS2 and GS3 papers for their mains as well as your perspectives during interview would be shaped by what we are going to discuss today. The argument. Now, recently, Union Budget was presented. It allocated 86,000 crores for healthcare, which seems like a decent sum. But as a percentage of GDP, it is only around 2.5%. This is total. Union government, state governments, and out of pocket expenditure total is 2.5% of GDP. This is the expenditure on healthcare. Now, what is the argument that is generally presented? That India must spend more, say around 6 to 7% of GDP on healthcare like advanced countries like European nations, Japan, or United States of America. This argument is based on an assumption. What is that assumption? The assumption is more spending on healthcare by government in terms of GDP would result into better health outcomes for the population. So we are saying that more money, if it is spent by government on healthcare, it is better health for people. Now, this assumption we are going to challenge in present discussion. Now, when government is trying to address any problem of healthcare in the country, it has two options. Either it goes for cure strategy or it goes for care strategy. The health problems may range from more deaths because of road traffic accidents or diarrheal deaths that occur under 5 children, which India is facing a huge burden, or it can be problems related to respiratory or diseases or contamination of water and so on, pollution. Now, what is cure and care strategy? Cure strategy, government tries to cater to the demand side by increasing the supply of healthcare. So, for example, if it is road traffic accidents, the deaths due to RTAs, the cure strategy would be more trauma centers, more ambulances, more doctors, more paramedical staff, drugs, surgicals, and so on. The care strategy, here the government would be emphasizing on prevention by attempting to reduce the sickness in population. So the care strategy would be reduction in RTAs. Now this can be done by better technology, better infrastructure, use of CCTVs, better enforcement of traffic rules, better awareness among people, and so on. So whenever government is trying to spend money to address a health issue, it can have either cure strategy or care strategy. Now I'll give you certain examples. Take the example of road traffic accidents, which I have already explained. Second is diarrheal diseases. Today we'll be focusing on this aspect more. 29 million children in India under 5 age, they've died because of diarrhea, and they continue to die as we speak. Diarrheal diseases are among the top 5 causes of deaths in India. Of the global deaths that occur, 1/5 of diarrheal deaths of children, 1/5, right, nearly 20%, they occur in India. So this is not good, right? Next, we have fluoride contamination of groundwater, or there is arsenic contamination. I just give an example. So fluoride or arsenic contamination of groundwater, which results into high rates of fluorosis in population. You can see the picture here, the skeleton. Now, other example is COPD. This is respiratory disorder. Respiratory disorder of the lungs, which occurs because of smoking, or it can also be because of air pollution. So when such problems are faced in the society and common man, right, ordinary citizens suffer, government has two options: either to go for care or cure or both, depending on how much money government has. So now let us proceed with the example of diarrheal diseases. Now when the diarrheal deaths are high, the cure strategy is to have more hospitals, more doctors, more paramedics, more drugs and surgicals, so that these people, the children, get required medical care in time, right? Now, the problem in this approach is you are addressing the demand. So there are patients and you are supplying healthcare. However, are we addressing the root of the problem? Because the children will continue to fall ill. So sickness is not addressed. You are just treating those who are sick. But the people who continue to get sick will continue to get sick despite what you are doing. So this is the problem associated with cure strategy. Now, if we speak about the care strategy, what is the solution to the problem of diarrhea? First is breastfeeding. So, for the first hour after delivery, there should be the breastfeeding by mother to the kid should start. There should be exclusive breastfeeding for 6 months. Nothing else should be given. But then, what happens in India? There is lack of awareness. So, either breastfeeding doesn't start in the first hour after the child is born, or exclusive breastfeeding for 6 months is not followed. So it is supplemented by water, it's supplemented by honey. There are other traditional foods that are given as supplements, or even milk is given which is adulterated with contaminated water, and so on. So this results into diarrhea in children, right? The other is clean drinking water. Now government claims that nearly 80 to 90% of people in India have access to clean managed drinking water. But the problem is, if you see tap water supply, door to door supply, we have not covered more than 55%. So nearly half of the population of India is yet to have clean drinking water at the doorstep. Apart from that, those who have, even though the people, this 55% who have clean drinking water at their doorstep, how clean is the water? That's a big question. If you go to European countries or other countries, you can simply turn on the tap anywhere and just drink the water. Be sure about its quality, its cleanliness. But in India, most of the houses that have piped supply still have water purifiers or water filters in their home. So this is a problem. There's a problem of clean drinking water. Next is hygiene and sanitation, so washing hands, and this is the most important part that we are going to focus today. It is the disposal of waste, so human waste, excreta, because this is the major cause for diarrhea, right? So we see open defecation. So if there is open defecation, it results into the fecal matter getting contaminating soil plus water, and this results into diseases, right? So this is a major cause. Now when we know this is the cause and it is preventable, all these four things are doable and they require less money, then why is the problem, after so many years of independence, why we still have one-fifth of global diarrheal deaths in children? The answer is office. So it's a very famous series you must have seen. This is your health ministry, and this is your ministry of Jal Shakti, which deals with clean drinking water and sanitation, right? Sanitation and drinking water, and here it is Ministry of Health, right? So drinking water and sanitation is under the Ministry of Jal Shakti and not the health ministry. Also, Swachh Bharat mission, this focus on sanitation, Swachh Bharat mission is also under the Department of Drinking Water and Sanitation, Ministry of Jal Shakti. Now just imagine this scenario, that one of the biggest health issues in India, which is diarrhea, right? Since this diarrhea is majorly caused by lack of access to clean drinking water. Now this is not under the control of health ministry, it is under the control of Jal Shakti ministry. We are not arguing here that everything that has an impact on health should be under health ministry. No, not at all. But then now the story begins, that if all these parameters are beyond the control of health ministry, how does more expenditure affect the health outcomes? This is the picture that is very famous, right? Swachh Bharat mission. So everywhere across the country, there's awareness. Every village and every city is trying to declare its open defecation free, ODF free status. You have such structures which are lined with advertisements, slogans, right? Everywhere about having a toilet and using that toilet. So it involves behavioral economics, or human behavior. Impact of human behavior is also here, right? The people are being nudged into using the toilets. This seems like a solution that government has spent a lot of money, and this Swachh Bharat mission is going to address the sanitation point of view when we speak about diarrhea. Now let us see the game changer. What we saw in this picture are the toilets that are being constructed, but then what we generally don't see is this, that the game changer is actually these two structures and not this structure. In place of this structure, you can have four bamboos or anything that you want wrapped with a cloth, doesn't matter. The point is, this structure, and this structure are the game changers. So, if our focus is on reducing diseases, giving access to clean water, preventing contamination of water, soil, food, right, and improving the public health, the game changer is this is called twin pit toilets. Twin pit toilet. So, when we speak about the Swachh Bharat mission, the problem is, you know what? UPSC aspirants generally use or refer second rate material which is ready made and available in the market. You do not read the basic documents. The documents clearly mention, the SBM document, if you see, it clearly mentions that this is the recommended structure, twin pit toilet, that every toilet that is being constructed should have these two pits. These are two pits which have specific scientific dimensions. So it should be 3 feet deep, 3 feet diameter. It should have honeycomb structure, right? This lid has a particular thickness, and such structures, these twin pits, should be nearly 10 meters away from any source of drinking water, right? So there will be less probability of contamination. Now, is this mandatory? The SBM gives approximately, I'm just stating approximate figures, 12,000 rupees as support for construction of toilet. This includes this physical structure of toilet plus the soak pits. Now, the Swachh Bharat mission tells the owner of the toilet who is constructing the toilet that he or she has multiple options. You can have soak pit, you can have twin pit structure, or multiple options, right, depending on his or her budget. So people have been given discretion to add their own money to this government support and then choose the style of toilet they want to build. The problem is, in India today, in reality, in 12,000, can you construct this, and this together? The probability is very low. So, what would people do? Just think about it. People are not aware. They are not aware of the policy. They are not aware of the science behind this sanitation. So, what would people do? People will focus on this structure and neglect this part. Now, is this just an opinion that I am making up? Look at the statistics. The reality. Twin pit toilets are considered as a role model, right, or the model to be implemented, which is recommended by SBM, Swachh Bharat Mission. Such toilets, there was a survey which clearly acknowledged that only one third, in most probability, only one third of all the toilets which are constructed under SBM use this twin pit structure. So, 70% nearly do not have this twin pit structure. Also, the 30% nearly which have this twin pit structure, because you gave discretion, right? The owner who construct the toilets has the choice to choose the design, to choose the mason who would construct it, and use the material of his choice. So this discretion, the problem of quality. So even in the 30% where the twin pit structure has been used, the quality is a big question mark, right? And why it is important? Because when we look at this, when we look at this picture, what is the how does it function? When the toilet is constructed, this is not to be used, only one is to be used. This goes on for 2 to 3 years, after which this is removable lid. You remove the lid and divert the flow this side. So this is kept like that for next 2 to 3 years, which turns it into manure, which is then safe, which doesn't contaminate soil and water, and can be simply removed and used in fields. Then after 2 3 years, you close this and again divert it here. So this is how it works. But in reality, we have seen that only one third, right, are such, and 30% the question of quality. So if it is not kept, if it is not built as per scientific rules and regulations, what will happen? The excreta or the waste will remain infected, and when it is removed, especially if manual scavenging is used, it will result into infections and spread of contamination to the nearby water and soil. Now, based on cost, this discretion is the problem. Plus, scientific design parameters are not generally followed, and there is no way of regulating it. Now, think about it. We have spent in budget on the floor of Parliament. This statement was made recently. 67,000 crores were spent are spent so far on Swachh Bharat mission. Now, this Swachh Bharat mission is supposed to take care of what? Sanitation. If we are saying it is to take care of sanitation, why do we want it to take care of sanitation? Because we want to reduce diarrhea or diseases in society. Why do we want to reduce that? Because we want to promote health and well-being of population, right? Now the problem is, even after spending so much, if the twin pit structure or scientific disposal of waste is not focused, then you will have toilets everywhere. You will have ODF, right, open defecation free status for villages and cities. But would people be healthy? Would diarrhea reduce? It's a big question mark, right? So this is what we are trying to focus. What is the solution? The health ministry must constantly be engaged with other ministries and departments at multiple levels to ensure that the recommended measures are effectively implemented. Why this is necessary? Because if you look at the incentives of Jal Shakti ministry, what is the incentive? To fulfill the target, right? To fulfill the target of ODF, open defecation free status, and construction of number of toilets, right? So the incentive of Jal Shakti mission is to construct the specified number of toilets, give tags of ODF free status to villages and cities, and say that we have successfully done our job. Swachh Bharat mission is a success. But think about it. When Jal Shakti mission is focusing on this structure, right, the superstructure, the toilet, right, the focus of Ministry of Health Ministry would be on what? Right, it is on this structure which is connected to the toilet. So health ministry is focused on this, whereas Jal Shakti ministry is focused on this, and then we measure the success of SBM by this and not this. This is the problem that we have. So a system of checks and balances needs to be established which will allow the accountability as per pre-decided standards. So how to measure whether SBM is or any such government scheme is successful or not? The outcome. Now what is the outcome here, right? What is the outcome here? This outcome is what? Reduction in diarrhea or improvement of health, right? So why I say that the implementation of such scheme at a national level, pan India level, should be like we should feel the stones while crossing the river. So you should not just jump into the river. You walk slowly, feel the stones, feel the depth, and go on forward. So what is the meaning in policy terms? That robust research mechanism and data and evaluation is necessary. So you do the pilots everywhere. You have declared, every village that declares itself to be ODF free, right, open defecation free, you measure the health outcomes there, measure the rates of infection, measure the change in the livelihood or the health indicators of under 5 children, right? So you rate, you study the prevalence and incidence of diseases, and if you find that there is a correlation between ODF status and reduction in diarrhea, then it is working. So your outcome should be measurable in relevant terms, not just the structure that is constructed, right? So what is the lesson? Do not lose focus. Chidiya ki aankh. Our focus should be health. SBM is associated with health. It's not just the village should look clean and you should not see people defecating in the open. Just looking at people defecating in the open does not cause you disease. The problem is the unhygienic disposal of the waste that is causing the disease. So every step that government is taking, every time data appears in newspaper when they say so many toilets have been constructed or such has been done, this much money has been spent, you ask the why. You ask how many of them have twin pit structures. Is the excreta disposed of properly? That is the right question to ask. Otherwise, if you analyze the budget by just looking at the numbers and say that अभी 2.5% है, इसको 6 to 7% आप कर दो GDP का, and then it is a magic wand and the whole problem of health is solved. No, the more amount of allocation will go down the drain, flush हो जाएगा सब पैसा, right? It may not result into outcomes. So what we need is robust mechanism to determine, measure outcomes and link it to the input that we are putting in the economy. Now, if you are interested in such discussions which open your eyes, give you a new perspective to look and evaluate the news, schemes, and all current affairs, join now. DCipher is a platform for such discussion. Upgrade your UPSC preparation before it's late. Download the app now. For all of those, subscribe to this channel. Stay tuned. Like, share, and comment on this video. Thank you. Have a very nice day.